Nagbabalik mga kasambahay ang Doctors on TV. Still talking about viral hepatitis. Marami palang klaseng viral hepatitis. A, B, C, D, and E. Yung A and E, foodborne, causes acute illness only. Pero ang B, D, and E, bloodborne or transmission through bodily fluids, pwede mag-cause ng long-term disease which eventually can lead to cirrhosis and hepatic cancer. We're still with our doctor from Medical City and Philippine General Hospital, Dr. Janus O. Good morning again, sir. So sir, let's talk about the short-term A and E muna, yung mga foodborne. Ano yung typical course ng isang pasyente na nagkaroon ng hepatitis A or E?
So yung mga A and E infection, yung foodborne infection, usually meron pong tinatawag na latency period. Yung time po na nakuha mo at and then lumabas yung mga symptoms ng mga a few weeks. And then pag may symptoms na yung patient, yung yellowing of the eyes, yung nausea, yung vomiting, yun naman ay mga a few days, mga 3 to 7 days. And then after that, magre-recover na yung pasyente. So yun po yung usual na nangyayari sa acute infection.
Full recovery, no?
Full recovery.
Even without treatment? Walang gamot?
Yes, no treatment. Overwhelming majority, mga 98 to 99% magre-recover. May mga maliit lang na yung tinatawag po na acute liver failure. Pero very, very rare.
And what foods do we get this from? Mga street foods ba? Mga hindi malinis?
Well, street food ang pinaka na-i-implicate kasi nga siguro in the way that they are prepared. But any food, any food that is prepared by someone who did not wash their hands before preparing the food can get contaminated.
Teka lang, no? Bakit wash their hands specifically? Doc, itong virus na ito ba, saan ang galing ito? Is this from the laway? Is this from fecal matter? Is this from unwashed vegetables? Saan po nanggaling itong virus na ito?
So it is fecal oral route actually. So sa dumi po siya na i-excrete o na ilalabas. Dun din po yun nakukuha. So kaya nga nakikita mo sa mga very good establishments na sinasabi nila that our employees are required to wash their hands.
Okay.
Pagkapalikuran.
Yes, pag pumunta sa palikuran, tapos pagbalik sa stations nila, dapat malinis yung mga kamay nila.
So again, this is for hepatitis A and E.
I-ano lang natin, Doc JM, no? Yung mga lines natin where they can text 0908 for smart ito, 814-3983. Kindly indicate your name, age, and location. Please, wag na muna kayong tumawag dito so we can accommodate more texters.
So, Doc, we proceed to the more chronic hepatitis na B, D, and E. Kanina binanggit nyo blood...
C, and D.
Sorry, B, C, and D. May na-skip ako letter, no? So, yung mga ibang nagpasalin ng dugo or mga sexual contact or bodily fluids, doon nakakuha ang B, D, and E. Can cause an acute phase, but later on, pwedeng may asymptomatic long-term, no?
Yes.
Mga how long kaya, no? Before patients become cirrhotic from a hepatitis B infection?
Kung magkakaroon po ng cirrhosis ang isang pasyente from hepatitis B or C or D, it takes anywhere from 25 to 35 years.
Okay, so matagal
25
pala.
to 35. That would be for the B.
For both B, C, and D.
B, C, and D.
Ika-clarify ko lang, yung D kasi para siyang parasite na virus. Hindi siya, you don't have D alone.
Okay.
Kailangan po may hepatitis B din yung isang pasyente, tapos pag sapitan ng hepatitis D, so meron ng hepatitis D infection. Actually, we talk about it, pero mukhang that's a very uncommon infection in the Philippines. So sa atin, more of the B and the C.
And an A.
A, yes.
Okay. Then we'll talk about, just quickly, there's cirrhosis. Ano bang cirrhosis and how does it later on lead to liver cancer?
So cirrhosis, yun po yung when our liver is very hard o maliit na siya at mapeklat. O nagsishrink na siya dahil dun sa dami ng scar tissue or peklat sa liver. Yun po yung end result. So lahat po ng mga liver disease, hepatitis B, hepatitis C, alcohol, fatty liver na tinatawag, lahat po yun, pag hindi po na gamot o na-detect o nabigyan ng pansin, lahat po yun nag-end up in cirrhosis o yung sobrang pagpeklat ng atay.
Hindi na
So-
makafunction ang liver ng tama, no?
Yes.
So, ibig sabihin, Doc JM, Doc Janus, kung yung isang tao meron ng HEPA, could be A, B, C, D, and G, no? At ito ay nag-alcohol. You mentioned alcohol earlier. Does it mean na mas lalala o mapapabilis? Instead na 25 to 35, let's say, pwede bang maging 15 years kung alcoholic din yung isang tao?
Yes, thank you also for bringing that up kasi especially for hepatitis C, very well known yung kapag umiinom ng sobra yung isang pasyente na may hepatitis C infection na yung kanyang progression o yung
Paglala.
time na mag-develop siya ng cirrhosis pwedeng umiksi to 15 years. Ganun din sa hepatitis B.
Okay. So, avoid alcohol na lang, no? Actually,
Always.
even in the absence of hepatitis C, avoid na lang alcohol.
Yes, and especially in the presence of hepatitis B or C.
Oo,
Yes.
kasi earlier ang complications ng hepatitis na
Yes.
pwede mag-cirrhosis.
Yes.
Okay, Doc, we said kanina testing for hepatitis is through blood testing, no? Some patients get an ultrasound, tapos nakita na sa ultrasound, ay normal naman ang liver ko, and they get to think na, siguro wala akong hepatitis kasi normal ang ultrasound ko. Does it follow ba na pag normal ang ultrasound,
Maayos pa yun.
wala kang hepatitis?
Hindi. Kasi you can have hepatitis and then the ultrasound kasi hindi naman siya 100% sensitive to detect
The
the presence of
virus.
inflammation or pamamaga. Ang ultrasound, maganda lang siya talaga kung mga masses o yung bukol na tinatawag or fat. So dun siya mas maganda at hindi siya 100% sensitive. So hindi ibig sabihin na normal ang ultrasound sa reading na nakuha mo na wala kang hepatitis B or C infection.
Then there's this test in medical city, yung FibroScan. I always see doctors requesting it. Ano naman purpose ng FibroScan? Will it also help with hepatitis?
FibroScan is a parang ultrasound din siya. It uses sound. But ang tinetest niya, hindi na yung parang titingnan yung atay kung may bukol o may fat. Ang tinetest niya actually yung peklat o yung fibrosis.
Okay. Fibrosis.
So pwede po siyang mag-detect ng degrees of fibrosis or peklat or cirrhosis. So yun ang kanyang purpose. So it's useful for patients with liver disease including hepatitis B and C.
Okay. But it doesn't find out if you have hepatitis B or not.
No, it's not a
specific.
test for the hepatitis virus. Blood test talaga yon.
Okay, so dapat talaga magpa-testing na tayo yung lahat, no, for
Lahat,
hepatitis B,
yes.
even if you don't have a family history. Before we proceed with our discussion, we'd like to introduce Naturally Yours, foods that fight breast cancer tumors by our host, Miss Yas Muralla.